Hello and welcome. Today, we're diving into a rare but important topic: urethral leiomyoma. This is a benign or non-cancerous, smooth muscle tumor that can occur in the urethra. We'll explore what it is, what causes it, how it's diagnosed and treated, and more. Let's get started. The exact cause of urethral leiomyoma remains largely unknown. However, several theories exist. One suggests that it arises from the smooth muscle cells within the urethral wall itself. Another theory proposes that hormonal influences might play a role, although this hasn't been definitively proven. Genetic predisposition is also considered, but further research is needed to confirm any specific genetic links. In most cases, it appears to develop sporadically without a clear identifiable cause. Pathophysiologically, urethral leiomyoma develops as a result of uncontrolled proliferation of smooth muscle cells in the urethral wall. As these cells multiply, they form a mass, or tumor, that gradually increases in size. This growth can cause compression and narrowing of the urethral lumen, obstructing the flow of urine. The obstruction leads to various symptoms, which we'll discuss later. The tumor is typically well circumscribed and encapsulated, meaning it's clearly defined and separated from surrounding tissues. Under microscopic examination, it shows characteristic features of smooth muscle cells arranged in bundles. Urethral leiomyoma is considered a rare condition. Precise epidemiological data is scarce due to its infrequent occurrence. It's more commonly reported in women than in men, although it can occur in both sexes. The typical age of presentation is between 30 and 60 years, but cases have been reported outside this age range as well. Because it's rare, many cases might go undiagnosed or misdiagnosed, contributing to the limited information available on its prevalence. The signs and symptoms of urethral leiomyoma vary depending on the tumor's size and location. Common symptoms include urinary frequency, urgency, and difficulty initiating or maintaining urination. Patients may also experience a weak urinary stream, straining to void or incomplete bladder emptying. In some cases, the tumor may cause pain or discomfort in the pelvic region. Urinary tract infections can also be a problem due to urinary stasis. In more advanced cases, complete urinary retention may occur, requiring immediate medical attention. Diagnosing urethral leiomyoma involves a combination of clinical evaluation and imaging studies. Initially, a thorough medical history and physical examination are conducted. Uroflowmetry, which measures the rate and volume of urine flow, can help identify any obstruction. Imaging techniques like cystoscopy, where a small camera is inserted into the urethra, allows direct visualization of the tumor. Ultrasound, CT scans, or MRI can also be used to assess the size, location, and extent of the tumor. Ultimately, a biopsy and histological examination of the tissue sample are necessary to confirm the diagnosis of leiomyoma and rule out any malignant conditions. Urethral leiomyomas are generally classified based on their location within the urethra, proximal, mid, or distal, and their size. They can also be characterized based on their growth pattern. For example, whether they are primarily intraluminal, growing into the urethral opening, or extramurals, growing outside the urethra. However, there isn't a formal, universally accepted classification system in place. The primary treatment for urethral leiomyoma is surgical removal of the tumor. The specific surgical approach depends on the tumor's size, location, and the patient's overall health. Small, easily accessible tumors can be removed via transurethral resection, where the tumor is shaved off through the urethra using specialized instruments. Larger tumors, or those located in more difficult-to-reach areas, may require open surgical excision through an incision. Post-operative care focuses on managing pain, preventing infection, and monitoring for any complications, such as urethral stricture or recurrence. Regular follow-up appointments are essential to ensure complete removal and monitor for recurrence. Currently, there are no known specific preventative measures for urethral leiomyoma due to the unknown etiology. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, is generally recommended for overall health. Individuals experiencing urinary symptoms should seek prompt medical evaluation to ensure early diagnosis and treatment of any potential underlying conditions. The prognosis for urethral leiomyoma is generally excellent, as it's a benign condition. Complete surgical removal typically results in resolution of symptoms and a low risk of recurrence. However, long-term follow-up is still recommended to monitor for any potential complications or recurrence. Research is ongoing to better understand the etiology of urethral leiomyoma and to develop less invasive treatment options. Some studies are exploring the potential role of targeted therapies to inhibit the growth of smooth muscle tumors, but these are still in early stages of development. Thank you for joining us today in learning about urethral leiomyoma.